Good morning, and thank you for attending. Today I'm joined by Dr. Carol Zimbalatti, public health physician, to provide an update on the local COVID-19 situation, and Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the COVID-19 vaccine rollout. NACI, the National Advisory Committee on Immunization, has issued a new guidance regarding the viral vector vaccines, AstraZeneca, Covishield, and Johnson & Johnson, in the last couple of weeks. NACI has recommended the use of these viral vector vaccines for those aged 30 and over, but they suggested that a risk management and assessment might help individuals make an informed decision as to whether or not they take the viral vector vaccine. The key message is that the risk of clots associated with the viral vector vaccines is very low. You have about a 99.999% chance of not developing a clot related to the vaccine. The protection these vaccines offer against COVID-19 infection is very strong, helping to prevent serious illness, hospitalization, and death. With the rising case count locally, our message is the same as the message province-wide. The best vaccine is the first vaccine available to you for the vast majority of the population. As the pandemic evolves, this recommendation can change. In pregnant women, however, the messenger RNA, Pfizer, Moderna vaccines are preferable. This is because the rare clots, which have been associated with the viral vector vaccines, are more complicated to treat in pregnancy. Though Canada has received a shipment of J&J vaccine, Health Canada, through its diligent vetting process, identified a possible quality control issue with the doses. They will not be released unless the quality concerns are proven unfounded. Currently, the health unit is only receiving supplies of Pfizer and Moderna vaccines. It is unknown when supplies of viral vector vaccines will be provided to our health unit. Locally, our district continues to have the lowest COVID-19 case rate in the province over the last 7-day period, April 24 to 30, as well as the lowest cumulative case rate over the course of the entire pandemic. Although our case numbers remain low compared to other areas of the province, our trend is upward, while the provincial averages decrease. We have a sustained increase in reported cases in our region since around the beginning of April. Until we're able to get everyone vaccinated, our only way to decrease the provincial numbers and have the shutdown stay-at-home order lifted is for everyone to follow public health measures. With that, I'd like to hand it over to Dr. Zimbalatti to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we had 20 new cases, bringing our total case count to 371, with 232 in the Nipissing district and 139 in the district of Parry Sound. As always, these figures are likely lower than the true value. We are still seeing quite a few cases related to community spread, meaning it is not related to travel and we don't know from whom the person contracted COVID-19. This means that there are likely other cases in our communities that have not been tested. In April, 2 cases were diagnosed only once they presented to hospital. At the same time, testing rates across our district have been lower than usual since mid-March. This is further evidence that there are more cases in the community than are reported in our numbers, and we must continue to work together as a district to help slow the spread. It also highlights the fact that we all need to be self-monitoring for symptoms. If you think you may have any COVID-19 symptoms or have been in close contact with someone with symptoms, first self-isolate and then use Ontario's self-assessment tool to see if you need to seek testing or further care. As of this morning, we have 22 active cases with 2 cases in hospital. There are 8 active VOC cases currently identified, but there is a delay in getting VOC screening results on identified cases. We have also seen a small number of COVID cases that have received their first dose of vaccine. It is important that everyone continue to follow public health measures even after receiving 1 or 2 doses until more people have been fully vaccinated, because the immunity provided by the vaccine is not 100%, especially after a single dose. Today at 3 p.m., you will also see a sudden increase in the number of variants of concern originating from the UK reported on the COVID-19 dashboard on our website. This jump is due to a change in how we are categorizing variants of concern. The new method aligns better with the way the provincial lab is screening for VOCs. VOCs are identified using 2 steps. The first step involves testing for mutations, and the second step, whole genome sequencing, is only performed if a sample tests positive for mutations other than the single mutation associated with a VOC originating from the UK. Prior to today, cases were classified as a VOC originating in the United Kingdom, or B117, on our dashboard only if they were identified as such through whole genome sequencing. However, starting today, cases with a positive result for the N501Y mutation and a negative result for the E484K mutation will also be classified as a VOC originating in the United Kingdom. This is based on provincial best practice and means that a number of cases that were previously classified as a preliminary positive VOC on our dashboard will be reclassified as a VOC originating in the UK. As with the rest of the province, cases with a VOC originating in the UK now make up the greatest proportion of VOCs locally. Based on provincial guidelines, VOCs originating in South Africa or Brazil will still require that second step, whole genomic sequencing, to be completed before we report them as such on the dashboard. With that, I will pass it back to Dr. Chirico.
Thank you, Dr. Zimbalatti. Ms. McLellan, can you please provide an update on our vaccine rollout this week?
Thanks, Dr. Chirico. Good morning, everyone. As of this morning, we have provided 46,775 vaccinations in our district. 2,705 of those were provided by pharmacies in our district. 42.1% of those 18 years of age and older who are residents of our district have received at least 1 dose of the COVID-19 vaccine. I'm very pleased to confirm that we met the provincial target of having 40% of the 18 and over population in our district receive at least 1 dose of COVID vaccine by April 13th. Our coverage rate was 40.8% on April 30th. As of this morning, individuals who were born in or before 1971 or essential workers in Group 1 who cannot work from home are now eligible to book their COVID-19 vaccine appointment. The Group 1 list includes remaining elementary and secondary school workers, which includes educators, custodial staff, school bus drivers, and administrative staff. Workers responding to critical events, which includes police, fire, special constables, Children's Aid Society workers, emergency management and critical infrastructure restoration workers. Enforcement, inspection, and compliance roles, which includes bylaw enforcement, building inspectors, food inspectors, animal welfare inspectors, border inspection officers, labor inspectors, and WSIB field workers. Remaining individuals working in licensed childcare settings, which includes all licensees, employees, and students on educational placements who interact directly with children in licensed childcare centers and in authorized recreation and skill building programs, licensed home child care and in-home service providers, and employees of home child care agencies. Foster care agency workers, which includes customary care providers, food manufacturing and distribution workers, agriculture and farm workers, funeral, crematorium, and cemetery workers. Last week, we opened up eligibility to child care workers in licensed child care facilities and individuals with high-risk chronic medical conditions and their essential caregiver. Just as a reminder, as the number of individuals eligible to receive a vaccine increases, Demand for an appointment will be higher than the appointments available. We ask that everyone be patient. There is no vaccine specifically allocated for any of these groups. Clinics are scheduled across our district based on the vaccine supply we receive. Beginning today, changes have been made to the provincial booking system, which now allows anyone who is eligible to book an appointment to do so online. I strongly encourage those who are able to book online appointments to do so. This will allow us to keep our phone lines open for those who have questions and those who are unable to book online themselves. We have had instances of some individuals trying to book their second dose appointment early and end up canceling the appointment they did have scheduled. We're asking that you not change your appointment. The current configuration of the booking system will not allow us to rebook these appointments. We are currently working through developing a process for second dose clinics and appointments. Additionally, the ministry is working to make changes to the booking system to support second dose appointments. So at this time, we ask that you not try to change your pre-scheduled second appointment. We are also asking individuals who don't have a second appointment booked as of yet. We are also working on how individuals who don't have a second appointment booked as of yet can book one, and we'll share that information once it is confirmed and available. And with that, I'll hand things back over to Dr. Chirico.
Thanks, Ms. McLellan, and that's it for our remarks. We'd like to answer your questions, so if you have them, please type them in the Q&A at the top of your screen, and our moderator will read them out loud. And we'll try to cover as many as we can. And when possible, please ensure your name is attached to the question. So Alex, if you could read out the first question, please.
Perfect. So my first question is for Andrea. It comes from Chris Dawson from Bay Today. Other areas have created call-in lines for standby lists. How is the health unit managing its standby vaccines?
We've implemented a process where we're reaching out to organizations who have employees within the priority groups that we're focusing on our clinics on. They'd receive, if we anticipate having vaccine left at the end of a clinic, they would receive a call about an hour before the end of a clinic, asking them to prepare a list of people who would be able to come for the clinic. They would then be notified closer to the end of the clinic how many individuals we require, and those individuals would be directed to attend the clinic and receive their vaccine.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Sarah Bissonette from the North Star. In press releases in last week's media conference, the health unit has said the number of cases from community spread is increasing. Ontario has been under a stay-at-home order for a month now. What red flags are raised within the health unit / medical community with the increased community spread under the stay-at-home order? If you could, in layman's terms, what does the data set tell us?
So I think the increase in community spread is just concerning to us because it means that there are individuals out there in the community that have not been tested that are transmitting the virus. So the message for the public is that if you have any doubt that you may have any symptoms of COVID-19, that we do encourage you to get tested so that we can identify all the possible cases and the health unit can do the work it needs to do to contact people who may have been exposed to the virus. Also, it highlights the fact that we all need to be so careful in terms of following the public health measures in terms of restricting travel from our homes to essential visits only. And when we have to go out, to be conscious of physical distancing, mask wearing, hand hygiene, all of the sort of messages that we have been promoting throughout the pandemic, because these, at this point, these are the measures that will really assist us in decreasing the spread in our communities.
Thank you. This is also for Dr. Zimbalatti. It's a follow-up question from Sarah Bissonette from the North Star. Could community spread be linked to people visiting the area / coming to their seasonal property?
It is possible. We do have a number of cases that are linked to travel, but I think we really do need to focus on what we can do as the community, and this is to follow public health advice. Certainly, as part of the stay-at-home order, it is not recommended that people engage in non-essential travel.
Thank you. Our next question is also for you, Dr. Zimbalatti. It's from Jennifer from The Nugget. Dr. Zimbalatti, you stated that there are a small number of COVID-19 cases after an individual received 1 dose of a COVID-19 vaccine. Do you know how many, and do you know their symptoms?
No, I'd have to get back to you on particulars of the information regarding individuals who tested positive following vaccination.
Thank you. Our next question.
I'd just like to add to that in that it does underline, and thank you for raising that question, it's important. We do know that the number is very low. Public Health Ontario has some information on that, which we can forward to you. But it's important for people to realize that once they do get a vaccine, they're not immediately protected. So they have to continue to follow the public health measures. And we know that it takes at least a couple of weeks. So the vast majority of cases that do break through are within those first couple of weeks. So again, it underscores the importance of following the public health measures.
Thank you. Our next question is for Andrea, comes from Jennifer from The Nugget. Any indication when teens will be able to be vaccinated in our region? Health Canada recently announced Pfizer has been approved for this age group.
Hi, that's a great question. At this point in time, it has been approved by Health Canada, but we have not received any direction from the Ministry of Health at this point in time with respect to the plans for immunizing children 12 to 17 years or 16 years of age, sorry. And we don't have a medical directive in place for that at this point in time. So there are a few steps that need to happen before we'll be able to move in that direction.
Thank you. Our next question is also from Andrea. It comes from Sarah Bissonnette from the North Star. There's chatter in Parry Sound that those over 70 are being sent to Bracebridge for a public health vaccination appointment. Why is this?
I'm not aware of that happening. There have been appointments in Parry Sound available, so I'm not sure. I'm not aware of that.
Thank you. Our next question is to Dr. Zimbalatti. It comes from Greg Bowman from the Moose FM. Just to clarify the new VOC reporting, you're going to be assuming that any mutation strains are the VOC originating from the UK until otherwise specified that they are a different strain.
Hi, Greg. Thanks for that question, because it is a bit of a complicated topic and maybe requires a little bit more explanation. No, they are not assumed to be the variant from the B117 variant unless they test positive for the one mutation, but the N501Y mutation, but they test negative for the E484K. So only that subset will be considered to be the B11 variant. Any test results that come back positive for the second variant will go on to further testing, and tests that screen negative for both mutations will be determined to be the early variant or the original strain.
And I'd like to add too that what we have found is that certainly as predicted, because the variants are far more transmissible, that they have essentially taken over, and they're a vast majority, highest percentage of cases that we do see that are positive are because of variants. And the most common variant that we're seeing in Ontario is going to be the UK variant.
Thank you. Our next question is for Andrea. It comes from Clark from YourTV/Cogeco News. Good morning. A report suggests 65% of Ontarians will be vaccinated by the end of May. What is the desired provincial case count / vaccine ratio? Thank you.
Sorry, can you repeat that?
No problem. A report suggests 65% of Ontarians will be vaccinated by the end of May. What is the desired provincial case count / vaccine percent ratio?
I don't have an answer to that question. We'll have to get back to you on that.
Yeah.
Go ahead, Dr. Chirico.
Oh, I was just going to add that it's difficult to know right now exactly what that would be, as far as if you're talking about, and I'm assuming that that's where the question is going, that you were talking about, well, when would it be safe to reopen, if that's what you're wanting to know about. How many people do you have to have vaccinated, and what are the case counts that you would require? We don't know that, and that's why we have to continually monitor the situation. And it's only part of the equation that we would use, and the information that we would need to look at when we would want to reopen. We have to look at the healthcare system capacity, public health system capacity, the trends at the time, whether moving up, moving down, and I think there's a lot to certainly consider before that decision is made. And I think that the other point I want to make is that nobody wants to go out of shutdown and then have to go back into it. And we want to ensure that this is the last shutdown and the last day at home that we have to do. And the best way to do that is to be very careful not to reopen too quickly. And we need to resist that temptation, because we've seen in the past and seen around the world that when that happens, then we end up having to go back into it, and we have a resurgence of cases. So let's all work really hard together to keep our case numbers down by following the public health measures, not traveling, and to only go out for essential reasons. If we can do that now, there certainly is hope on the horizon, light at the end of the tunnel, and let's work really hard and tough it out for the next little while to make sure that this is our last shutdown.
Thank you. Our next question is for yourself, Dr. Chirico. It's from Eric from CTV News. Prime Minister Trudeau says Canadians can start traveling outside the country starting in the summer if all goes well. Does Dr. Chirico's feelings on summer travel align with the Prime Minister's, or is it still too early to consider non-essential travel safe?
Yeah, thank you for that, Eric. It's a great question, and we're all anticipating and wanting to have a COVID-free summer. I agree with you in what you just said, is that I don't think that we can make that determination right now. I think it's too early, and as I just said, if we all work really, really hard and keep the numbers low, then we can look forward to certainly a better future without all the restrictions. But right now it's too early to tell.
Thank you. Our next question is also for Dr. Chirico. It comes from Tom from Radio Works. Last week, Parry Sound Health Center CEO Donald Sanderson stated, quote, the reported number of cases for the district of Parry Sound on any given day can likely be multiplied by 4, unquote. In your opinion, is this an accurate assessment based on the non-permanent resident COVID-19 cases not being reported by the health unit?
Well, I think that certainly needs to be qualified. First of all, because of what we've just been talking about, community spread, I think in general, and I can't say for sure what the actual number would be of the numbers coming in and out, but what I can tell you is because we have community spread and you don't know where you've got it from, we do know that the number of cases are likely very much underreported. So there are more cases that we don't know about than we actually test positive for. And yes, there's no question that if people coming up from hot spots, do they contribute to community spread? Certainly. But we also have to remember too that we all have to apply the public health restrictions to our own actions and do what we can to prevent the spread within our community. So you have to assume that it doesn't change anything, that you know that what we need to do, which is follow the public health measure. Assume that everybody that you come in contact with has COVID-19 and really only go out for essential reasons. We also know too that serology studies, which means that they take some blood, they look at, do you have antibodies? And these are in asymptomatic individuals. No, they didn't know if they were sick or not. And this was done a while back, and they found that just with the regular COVID strain that originated, that we had, there was about, for every one person that had, there was about 5 that they found that probably came in contact with the virus. So with the variance of concerns, it's probably even higher than that. I can't quantify it right now, but it doesn't change anything that we need to do individually.
Thank you. Next question is also for you, Dr. Chirico. It comes from Chris Dawson from Bay Today. Dr. Chirico, with more vaccinations being offered to more teachers and school staff, are you hoping kids can return to school again this year?
We really recognize how significant an initiative it is keeping kids out of school. It's really, affects social, mental, and physical well-being. And we worked really hard from the beginning of the pandemic to keep kids in school because we recognize how important it was. Even when there was a shutdown before, we had the option. And we chose to keep kids in school, and we were able to do it. I mean, the education here, the teachers, the staff, the administration, they did a fantastic job to put infection prevention and control measures in place, and we didn't have a school outbreak. So to answer your question, I'm really hoping that we will be able to get the kids back into school. However, the best way to do that is really for everybody to work hard. If you can keep the community transmission of the disease low, then it's going to be a lower risk for the kids in school. That is the main thing that we have to focus on. So let's all work to keep the case numbers down, because that's going to influence the decision to go back to school to get the kids back. So I'm hopeful that if the trends change, because ours are starting to increase. So if they change and start decreasing and people are doing what they need to do, then yes, I'm hopeful that we'll be able to do it. But again, it's ever evolving and it can change at any time.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Mo from Parry Sound Now. Parry Sound Now. Good morning. In the last 7 days since last Wednesday, 21 cases of COVID-19 were added from Parry Sound. Can you please comment on that and what you think may be behind this? 21 cases is about a 17% increase in Parry Sound's total case count in 1 week. Do you think this is where the increases end, or is this the beginning of a short localized wave?
I think the answer to that, and the public really holds the key in terms of determining whether this is a little blip or whether it is the start of a protracted wave. And it really depends on each individual's actions in terms of following public health measures, just as Dr. Chirico said, making sure that we assume that everyone we come in contact with, whether we're in Parry Sound or whether in North Bay or Sturgeon Falls, wherever we are, assume that everyone we come in contact with outside of our household has COVID-19 and that we take the appropriate precautions and we don't travel unnecessarily. So, yep, we are seeing more community spread in Parry Sound District than we are elsewhere, but it is possible that we can nip that in the bud with the appropriate measures.
Thank you. Our next question is for Andrea. It comes from Jennifer from The Nugget. Do we expect the time between first and second doses will be reduced? Has the health unit heard anything from the province on this front?
I know that the ministry is actively discussing the interval between the first and second dose. At this point in time, we've had no direction to change that from the current 16-week period, but we will follow whatever direction the ministry provides to us when and if they make any changes to that.
Yeah, I'd also like to add, that's a great question, because we're asking the same kind of question too, because if we can get 2 doses into people, it provides certainly complete better protection and completes the series, and we all want to do that. And a lot of it's going to be dependent on vaccine supply, and which we anticipate certainly will change. Probably later on at the end of the month to the beginning of June, we anticipate more vaccine, which is great for everybody. And we hope that then we'll be able to lessen the interval for sure. But that, as Andrea has said, it really will be coming from the province to make that decision.
The next question is for Andrea. It comes from Jennifer from the Nugget. According to the provincial schedule, those 40 plus are scheduled to book their vaccines starting Monday. Is that still the timeline?
It's starting the week of May the 10th. It's not actually starting on Monday. We don't know for sure which day it will be announced. 50 plus was announced today. And so as soon as those timelines that have been announced are on track, I just don't know exactly what day of that week that they will be announced.
Thank you. Our next question is for Dr. Chirico. It's from Sarah Bissonnette from the North Star. Out of 10, 10 being the worst and 1 being the best, how is the healthcare system within the health unit holding up at this point?
I couldn't hear you, Alex, with that question. Could you repeat it, please?
So it says, out of 10, 10 being the worst and 1 the best, how is the healthcare system within the health unit holding up at this point?
Oh, as far as morale, is that what you're referring to? As far as how we're doing together, I would we're doing great as far as the staff goes. They've been just absolutely amazing. And any time that we've asked them to help out, and believe me, things change from day to day, and there's so many variables, so many things that come up. They always step up, and they've been great. They do it with a smile. They support each other, and it's been difficult. There's no question, and everybody's tired. Certainly, it's been a long haul over more than a year now. Dealing with this every single day, but I'm really privileged to work with such a group of professionals that they really care, and they're really trying to help keep everyone safe. So we're doing great, and we know that there's certainly a light at the end of the tunnel, and there's certainly hope on the horizon that we can see better times soon. And I know that the staff will be there to get us through it.
Thank you. And then in follow-up, what is the capacity like in our hospitals in our district?
I think that's a question that certainly would be better answered by the hospital. We work very closely with them. We attend meetings with them in planning, Dr. Zimbalatti and I, and Ms. McLellan. So we're in constant contact with them. And I can tell you that they have an amazing team. They've been doing incredible work to prepare, work with us. They're great partner to have, and I have nothing but wonderful things to say about them. They have stepped up to help the rest of the province that's in trouble in their ICUs, transporting patients. They have all the personnel trained and appropriately. They've been working on it for a long time. So they put their lives on the line every single day, and they've been doing an absolutely incredible job. And I hope that people have a big shout out for their healthcare workers when they see them, for all that they do every single day.
Thank you. Our next question is for Dr. Zimbalatti. It's from Eric Thompson. Sudbury's health unit recently started posting details about private workplaces outbreaks in the region. Is that something the North Bay Parry Sound District Health Unit will adopt?
There are no immediate plans to adopt anything of that sort. We actually locally have been very fortunate in not seeing much in the way of workplace outbreaks. And so any decision we make regarding what information we post is related to public safety and whether the information provided will increase the public safety. And at this point, with the way that we've been able to keep on top of our contact tracing and making sure that workplaces are advised when there are cases that may have involved exposure at their businesses. We don't feel that at this point it has been warranted to post information regularly about any of the cases that have been well managed.
Thank you. Our next question is for Dr. Chirico. Comes from Jennifer from the Nugget. Has there been any link identified between the local anti-mask, anti-lockdown rallies and the upticks in infections reported over the last few weeks? Do you see these rallies as being responsible? As an example, the 10 cases reported this past weekend.
I think that certainly when people do have that right to protest, that is part of democracy. It's very embedded in it. However, I think that when people are gathering, they're not social distancing, they're not wearing masks, I think it's highly irresponsible for them to do it, and they're putting the lives of others at risk. And I think it's extremely selfish as well. When you look at, and from what I just said, our healthcare system is in crisis. We are receiving patients from Southern Ontario, COVID patients on ventilators. Our healthcare workers, first responders, they're all putting their lives on the line to protect these individuals that are protesting. And I think that at the very least, they should start considering what other people are doing to keep them safe. And yes, you can protest, but please follow the public health guidelines.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Jennifer from the Nugget. Is there a reason attributed to why COVID testing has dropped off?
I can't give a good answer to that. I mean, certainly since schools were closed, we saw a decrease in testing following the school closure. But apart from that, I'm not sure whether there's an element of complacency that is involved. So I think we'll take this opportunity where we are seeing this drop just to remind people that it is still very important, if you do have any symptoms that may be COVID, to at the very least self-isolate until you take that self-assessment test that is available on the provincial website to determine whether you do need a test or whether you need to seek further care.
Thank you. And so we have no other questions submitted, so that will complete our press conference for today. Thank you for attending. We will have the recording up on our website this afternoon, and we will be back next week on Thursday at 10 a.m.